All right, hello everybody. This is Dr. Cory Singer. Today I'm going to talk to you about an important subject, which is high blood pressure, and let's get right into it, okay? So first of all, let's talk about what the definition of high blood pressure is, and that is obvious, right? The condition in which the force of the blood against the artery, which is inside any one of our arteries in our body, is too high, or considered too high. I put that in quotation marks because we're going to talk a lot about what is too high, where do those numbers actually come from. So what is the blood pressure? It's measured systolic over diastolic, and pretty much blood pressure is measured. There are two numbers that actually result, which measures two different pressures. So the top number, which is the systolic pressure, is the blood pressure when the heart beats while pumping blood. The second or bottom number is the diastolic pressure, the blood pressure when the heart is at rest between beats. So it's the pressure of it contracting versus when it's resting. Okay. So who's affected? Now, this is crazy. 1 in 3 U.S. adults have, or 75 million people are considered high blood pressure, and hypertension costs the U.S. $46 billion each year, which includes the cost of healthcare services, medications to treat high blood pressure, and missed days of work, so like doctor's visits, things like that. Now, we want to know what blood actually does when we're talking about blood pressure, right? So blood is used to carry nutrients and oxygen to tissues, right? So you eat your food to get your nutrients and your air and from breathing, and that goes to all the different tissue types in your body. It also removes waste from tissues, and then one of the major wastes that the blood removes is called carbon dioxide. You breathe that out. And it also has a function for the immune system, right? Immune cells get filtered through it or get passed along through it. It's meant for repairing, so coagulation. So if you get a scratch or a scrape or something like that, or internal damage, the body will go and repair that tissue through the blood. Also there to transport hormones, regulates core body temperature. How that works is from different pressures or different temperature, things like that, the body will actually send blood to either your internal organs or your external organs, depending upon what's going on in your environment. And interestingly enough, the blood rebuilds itself every about 125 days. Okay. So now we got to know about what arteries are. So veins and arteries are different. The main difference between what arteries are and what veins are is that arteries actually have a layer of muscle that constrict and relax based upon the demand of the body in different tissues, right? So what you're seeing here is you're seeing that layer of muscles that surrounds that artery, or that's internal inside of the artery. Now we're going to get at this from an aspect of what's called vitalism. Vitalism pretty much means that the body has an intelligence inside of it, which is actually giving to it its procedures, or allowing it to do what it's supposed to do. The natural force in each of us is the greatest force in getting well. Now, when we look at the body, we want to understand what the importance and the principles of wellness are. So let's talk about this, right? So all living things are composed of individual cells. The body always responds to the most appropriate way to any stressor. So if there's a stressor in the environment, the body's going to respond appropriately to that. Cells will never dysfunction without a physical, chemical, or emotional stressor. And with that being said, health is a state of consistent homeostatic cell function, meaning the cells are doing what they're supposed to do. They're in a state of homeostasis. Sickness, therefore, is a lack of consistent homeostatic cell function, or a state of forced adaptive cell function. In other words, the cells have to do something that they're not really wanting to do at that point, but it's doing it to save the health of the cell and also of the entire organism. So therefore, disease is merely the intelligent adaptation to a toxically stressed system. So when that cell adapts or changes, it actually can produce symptoms, and those symptoms we label as disease. But really, all they are those symptoms are just the body and its a way to actually adapt to your environmental stressors. An example of this, diabetes. So the body is bombarded with too much sugar. So the body smartly adapts and blocks insulin from taking in more sugar into the cells. So you'd say, okay, well, type 2 diabetes. So what is it? The cells stopped taking in sugar. Well, it did that for a reason. It did it to protect the cell, okay? Because it didn't want more sugar getting into the cell because it would become toxic at that point. The pH levels would become way too variant or too off or too extreme. So what the body does is actually will say, okay, well, we've had way too much sugar in here. Let's just make it so these insulin receptors don't respond to that sugar that you're putting into the environment. Now, is that cell broken? Is it doing something that's bad? No, it's actually doing the right thing because it's trying to protect you. So what actually does need to change is the environment or what you're eating in this situation. So therefore, cause of disease, or I put that in quotation marks, dis-ease, is two different things. We have toxicity or deficiency. Deficiency is pretty much really simple. Not enough of the good stuff going into the cell or what the cell needs to survive. Things like nutrients, nerve supply, things like that. Versus toxicity is too much of the bad stuff, right? Chemicals, drugs, things, too much sugar, foreign invaders, all these things can actually be bad, harmful for the cell. Now I'm going to actually skip this one here and that one. So what we're talking about here are those environmental stressors, things like this, right? Traumas, toxins, and thoughts. So traumas are things like physical stresses, toxins, chemical stresses, and thoughts are emotional stresses. Now what happens with when increased blood pressure? Now a combination of neural and inflammatory processes in the body which then thicken the blood and harden/thicken the blood vessels. So again, in this situation, we talked about diabetes being a symptom of adaptation. High blood pressure is simply your body's way of adapting to the environment, right? So, and it's particularly adapting to physical, chemical, and emotional stresses. So therefore, high blood pressure is not a disease, but a symptom of adaptation, which should be addressed to return normal homeostatic cell function. Okay, so in other words, we're not going to try to medicate the body or try to make it so that the body is to force it to do something that because it's just trying to adapt to the environment. What we need to do is actually address the environmental causes and the environmental factors which are creating the high blood pressure in the first place. So this kind of is a slide of just showing what your body does in response to stresses, okay? And you can see here, stresses are things like, the type of nervous system or the nervous system that controls stressful environments is called the sympathetic nervous system. And what puts your body into a relaxed state is called the parasympathetic nervous system. So sympathetic normal responses. So what happens, let's say let's say there's a physical or emotional stress, like let's say that you're running from a tiger, okay? That would represent a emotional or environmental stressor. What your body will do is the following, right? It'll increase cortisol. It'll increase catecholamines like epinephrine and dopamine. It'll increase the heart rate and it will increase the blood pressure. It does that normally. Because if we're looking at it, let's say for this example, if we're trying to get away from a tiger, right? Let's say the tiger is coming after us and your body needs to get away from it. What's going to happen is your body will actually constrict the blood vessels that go to your internal and digestive organs, and it'll make it so it'll increase it'll increase blood pressure, so your blood will actually send more and it'll direct it towards the external, so then towards your legs or to your arms, to make it so that you could run away from the tiger and get away from it, okay? And it does that naturally, normally. It's an adaptation to an environmental stressor in this case. So again, that's a good thing. We want that. Okay. Now we're going to talk about it if your body is under a stress or in terms of high blood pressure, chronic stresses, it will do that to protect the body. Okay. It'll increase blood pressure to protect yourself. Okay. Now we have these other factors. High you'll increase blood cholesterol, noradrenaline, clotting factors. I'm not going to go into all of them. Okay. But if you get the body shifted into what's called a parasympathetic or rest and digest state, what'll happen is it'll decrease the blood pressure. So we're going to utilize that or take that into our advantage when we're talking about how to correct high blood pressure naturally. Now, traumas. Okay, so this is that first type of stress. These are things that have been that are environmental factors again that will lead towards high blood pressure, right? Things like being overweight, okay? Physical inactivity. Pregnancy, actually, although not a true trauma, okay, but does increase your blood pressure naturally. Toxins, things like tobacco. This is a really obvious one. What happens is it actually damages your blood vessels as well. Alcohol could damage the heart. High levels of sodium can lead to water retention. So if you're eating too much salty foods, what can happen is that you can actually increase the amount of water that's retained inside of your body, and it makes your kidneys have to work a little bit harder too. Low potassium levels, right? Excess amounts of sugar, excess amounts of caffeine, food that could also increase your blood pressure. Foods with high trans fats and omega-6 fats. So high trans fats, what those are pretty much toxic fats, which actually increase the amount of inflammation inside your body and increase high blood pressure at the same time. Also, dehydration, which is actually a critical factor, can increase your blood pressure. When you're dehydrated, what ends up happening is that your blood actually tends to be a little bit thicker. So what your body has to do is increase the amount of pressure to be able to move that sludge, we'll use this example, that sludgy type of blood through the arteries and through the veins. Okay, so that's what your body will do in response to dehydration. Thoughts. I gave you an example of that tiger being in emotional stress, but usually every day we're not really, well, first of all, in that example, if there was a tiger in the room, as soon as we got away from the tiger and we knew that we were safe, our blood pressure would actually normalize and will drop down to a normal state. Stressors nowadays, and we're in 2020, in this environment you're looking at stresses like, let's say financial, let's say relationship types of stresses. You have those types of stresses which are more chronic in nature, and if you don't find normal and natural ways to solve those kind of problems, they become chronic, and if those chronic stressors will actually chronically raise your blood pressure. So that can do it. Now, I want to talk a little bit about the guidelines, because when we talked about what is high blood pressure, there's these guidelines that are created by this system called the Joint National Committee, right? It's a Joint National Committee. They've gone through and they've met several times to find out what they think is considered normal and what's considered abnormal, right? And so let's just talk about them, right? This was in 1997. This is Joint National Committee number 6. They gave an optimal blood pressure of below 120 and below 80 for systolic over diastolic. Now, that would be optimal, right? Normal, they considered normal anything under 130 over 85. High normal was between 130 and 139, or 85 over 89 for the diastolic. When you got into hypertension, stage 1 was 140 over 159, or 90 over 99. Stage 2 was considered 160 over 179, 160 to 179, or 100 over 109. And then stage 3, anything greater than 180 over 110. So for those two respective pressures. In 2004, they met again. They started labeling pre-hypertension is between 120 to 139, or 80 to over 80 to 89. Now that was what used to be considered normal in the JNC6. Now if the blood, and this is the rules they gave, right? If blood pressure is less than 20 over 10 above the goal blood pressure being 120 over 80, consider initiating therapy with 2 agents, so 2 different drugs, usually a thiazide type diuretic. So they would actually drop water out of the system using diuretics to lower blood pressure. Now, we talked about what dehydration can do in the long term for blood pressure, right? So you're lowering blood pressure and your body's going to respond by trying to actually increase the blood pressure. So you're creating an internal struggle inside the body. Stage 1, 140 to 159 over 90 to 99. Stage 2 is 160 or greater, or 100 or greater for the diastolic. Now, what were the health outcomes when they actually started using medications to with and without blood pressure medications, right? So standard medical treatment for elevated blood pressure is to prescribe those beta blockers, ACE inhibitors, and diuretics, along with convincing the patient to restrict salt in their diet. Now, what happens when we give blood pressure medications? Does this get to the root of the problem? Like I was mentioning earlier, the body actually has to work harder to actually go through it, right? So the example I would give is, let's say that we have an artery that's it's being clogged, okay, from food, right? That would be one of the stressors, right? Let's say that we have some trans fats and it's actually starting to coat our arteries. What ends up happening is the body will naturally have to raise the blood pressure in order to get the blood circulating into, let's say, the arm in this example, okay? If you give something like a drug to lower the blood pressure against the body's will, it never really got rid of that clot, right, or that clogging of the artery. So what ends up happening is your body says, well, I still need blood to get to this arm, and you gave me a blood pressure medication which drops my blood pressure. Now my body has to work even harder to get that blood pressure to where it's supposed to go to, okay? Again, you're working against the system. I get it, and there are certain instances where blood pressure medication can actually be really life-saving and really needed, but in my opinion, most of the time it's overprescribed, okay? Especially if we're talking about long-term use of it, and without actually addressing the cause of the problem, okay? So short-term, to be used for emergencies, things like that, I get this, but if we're using this as a long-term type of solution, it's not a solution at all. It's just a temporary, it's a mask. It's just masking the symptoms, never actually addressing it. And we're going to talk about what happens to your body when you start masking symptoms, okay? Now, here's the University of Alabama at Birmingham. Now, blood pressure medications can lead to an increased risk of stroke. So that's the title of this journal article, and this was in 2015. Scientists found that the risk of stroke went up by 1/3 for each blood pressure medication given. 33% rise for every medication given. People who need 3 or more meds were at a 248% higher risk for stroke in this situation than those with normal systolic blood pressure. Okay, so that's just one of the risk factors. Diuretic trials, right? Multiple risk factor trial. This was a study designed to show that reducing hypertension, high cholesterol, and smoking would lower coronary mortality. But so that was their goal for this. Okay. Now, after screening 350,000 middle-aged men, close to 13,000 believed to be at a greater risk were selected. In other words, a greater risk. They were divided into treatment and control groups. In other words, control groups got placebo, sugar pill, something like that, and the treatment group got blood pressure medications. Okay. Now, the treated group had the highest mortality rates. In other words, now what happens is more of them died, okay? So 42,000 more people died in the treatment group versus the non-treatment group or the control group. What they think is probably from ventricular fibrillation due to potassium depletion, right? So the body was having to work harder and harder and harder to try to keep up with the demands for that blood pressure that it actually needed, and these people ended up dying faster. Now, their goal was to get blood pressure below 140 over 90, 140 over 90, which is, if you look at we're going to talk about what the new blood pressure rules are, and they're a lot less than this number here, okay? Now here's the JNC8. This was in 2014. So treatment to lower blood pressure to 150 over 90 in those age 60 and older. So because as we age, your arteries become a little looser, and you actually need a higher blood pressure to circulate the blood pressure through the blood through the system, right? Because that's what it's needed to do: get the nutrients in, take the bad stuff out. Now, 140 over 90 for adults less than age 60. So they wanted, so over 60 is normal, 150 over 90. So that was the new guideline. Over age 60, the normal was 150 over 90. 18 and older with diabetes using drug treatment for a goal of less than 140 over 90. Now this is in 2000. They just recently came out with this last year. This was the new blood pressure rules here. So blood pressure category normal was anything less than 120, for systolic and less than 80 for diastolic. Elevated would be considered anything between 120 and 129. That's already elevated blood pressure, not necessarily hypertension, but elevated. And then less than 80 still for diastolic. High blood pressure, in other words, hypertension, stage 1 is 130 over 139, or 80 to 89. So that was actually now high blood pressure. Stage 2, 140 or higher, 90 or higher for diastolic, and then a hypertensive crisis is higher than 180 and or higher than 120. Okay, so that's the new ones. Now, here's a study here from the Journal of the Medical Association here. 48,000 heart failure patients from 259 hospitals from 2003 to 2004 with high systolic pressure had lower death rates. Okay, so they found these people with higher systolic blood pressures actually ended up having lower death rates. Mortality rates were more than 4 times higher for those with systolic pressure less than 120 in comparison to those who had pressure of 161 or higher. In other words, what they were finding was that people that actually had higher blood pressures had lower death rates. Again, why is this? This is because these people with the higher blood pressure, their bodies are doing what they're supposed to do by increasing the pressure, because we're trying to get blood to the tissues and trying to get stuff out of it, okay? Now, if we're trying to lower blood pressure naturally, what are some ways that we can do this? Posture, of course, number one, the first thing you want to do is you want to make sure you're taking the blood pressure naturally, or in a safe, or not a safe way, but just like a normal way, which is going to lead to an accurate description of what's actually happening inside your body. Breathing techniques can lower your blood pressure. Adjustments, so this is chiropractic adjustments. Science-based nutrition, so we're talking about different nutritional approaches for this. Dietary, supplements, essential oils, detoxification protocols, right? Exercise, stress reduction, and maintaining a healthy weight. All these things can actually do, or just simple things that we can do to normalize our blood pressure. Now, here's how we are supposed to properly measure your blood pressure, okay? You want to check your blood pressure over multiple consistent times during the day for at least a week, okay? Because the reason for this is if you just rely upon what your blood pressure is on just any given day, particularly if you're going into like a hospital, let's say you're nervous or you're concerned about what your blood pressure is going to be, usually as a stress response to your body, it'll actually just naturally raise your blood pressure, right? So you want to do it over a consistent period of time, over about a week or so, okay, before you just kind of say, you know, I went to the office, you know, that one day was, you know, my blood pressure was elevated, so I'm gonna have to take a blood pressure medication. If that were the example, right, let's say that we just went to any random gym and we start taking people's blood pressure in there, of course their blood pressure is gonna be high because their body has that demand for that blood at that point, okay? Now, so let's say you're doing it and you're taking it, you know, in the morning when you wake up, right? You want to breathe what's called diaphragmatically, or diaphragmatically. There's different ways to pronounce that, for at least 10 minutes. So you're breathing nice, big, deep breaths. We're going to go over that in just a second. And you just sit there for about 10 minutes and do that, okay? Now you sit with both feet planted on the ground and your back supported and your arms at heart level, okay? So in other words, your heart's not up here, it's not down here. You want it at heart level because that's getting the most accurate description of what's happening at that heart level. You want to make sure your bladder is emptied, okay? Why do we do that? Because more pressure inside of your bladder equals more pressure in that system. On top of that, it's just uncomfortable to have your bladder full, right? You're kind of doing a little dance there, and that's going to make your blood pressure elevated. You could do this. You're supposed to do it in a warm room, right? So, because if you have a cooler environment, your arteries have to actually constrict to move blood through the system, right? So you want to have a nice warm room, okay? That'll actually normalize blood pressure. You want to make sure your cuff size is chosen correctly, right? If you have a very large arm and you have a very small cuff, and you put that cuff on the large arm, it'll give you an inaccurate description. Same thing, if you have a very small arm, like smaller than what we consider a normal arm, if you have a small arm, right, and you put this big blood pressure cuff, and you measure it, it's going to come out usually lower in that sense. So also, on top of this, you want to make sure you're not talking during your measurement, right? So you're relaxed, you're not talking, because talking will actually change your blood pressure as well. And it's best to test pulse pressure instead of blood pressure. I know this whole time I've been talking about high blood pressure. A more accurate description of what's happening inside your body, because we said that, you could have, just because you're lowering your blood pressure or getting it to a lower blood pressure, it doesn't necessarily mean that's the healthiest thing for your body, right? It just tells you that that's a lower blood pressure. What's better is to tell if your body is naturally or properly responding to those stressful things inside of your environment, right? The way to test this is a thing called pulse pressure. Pulse pressure simply measures the difference between the top number and the bottom number, okay? Because they should go up and down together, okay? So let me show you what that is, okay? Blood pressure changes with adaptation, like I said. Pulse pressure should remain consistent at 40, okay? That's the number. So if you're taking the top number, I just wrote it here. This is the difference between the top and the bottom numbers, right? A pulse pressure of 40 is considered normal. So 120 over 80 or 200 over 160 would both be considered normal because they both have the same pulse pressure. In other words, that person that has the higher blood pressure, and as long as the pulse pressure is good, their body is doing the best that they can to make sure that the blood is going to where it's supposed to be and without harm, okay? Greater than 60 is considered high. Okay, so if that number, instead of it being 40, if it goes up to 60, there's a big difference between the top number and the bottom number. That's where you're actually starting to have a more of a problem. It's not just natural adaptation that's happening there. Now, here we talked about diaphragmatic breathing or diaphragmatic breathing. Now, you want to do this, you want to breathe in for 8 seconds and hold, okay? So you sit there, breathe in, so I wasn't doing it for 8 seconds. Hold that for 10 to 32 seconds. So once you breathe in, hold that 10 to 32 seconds, and then breathe out. You exhale for 16 seconds, and you exhale through the mouth. So you breathe in through the nose, 8 seconds, hold it, breathe out for 16 seconds through the mouth. And if you can't do it for 16 seconds, or if you can't breathe in for 8 seconds, don't stress out about it, because that will change your blood pressure again. You just want to just relax and just do this to the best you can, right? Hold with no air for 10 to 32 seconds, right? So so you breathe in 8 seconds, hold it for 10 seconds, however long that is, and then you hold that with no air for 10 to 32 seconds. Then you repeat that. You can do this up to 30 minutes. This is more of you would call it a treatment for high blood pressure, right? Because what ends up happening is this can actually lower your blood pressure just by doing this. Relaxes the whole body, takes the body into a more relaxed state. So I talked about, here's the nervous system, okay? So the nervous system, pretty much the brain, spinal cord comes out and it goes into all the different parts. I talked about how the sympathetic and parasympathetic responses happen. Now what ends up happening is if you have a bone in your spinal column and it's out of alignment, let's say it's putting pressure on something like a nerve, that will act as a stressor to the system naturally, right? So your blood pressure will naturally rise in that instance. So things like this is called just an x-ray of somebody's spine from a side view. After adjustments, you see that the natural curve in the neck can actually come back, because we're actually meant to have a normal curve or a C-shaped curve inside of our neck, which looks something like this. After adjustments, we could actually get those curves back. Same thing, this person here that's leaning off to the side and their head's tilted will actually usually have higher blood pressure because they have more stress on their system, okay? More sympathetic state. When you put the body back into its normal alignment, the body gets back into a more relaxed state and the blood pressure has a tendency to normalize. This is a study, just one of the studies that's showing this phenomenon. This is the Journal of Manipulative Physical Therapy in 1988. It was a long time ago. Effects of chiropractic treatment on blood pressure and anxiety. Right, it's a randomized control study. They measured systolic and diastolic blood pressure decreased significantly with adjustments. And here's the Journal of Human Hypertension in 2007. Atlas vertebra realignment and achievement of arterial pressure goal in hypertensive patients. So what they found out when they adjusted that top vertebra, which would be like somewhere up in this part right here, so C1, when they adjusted that bone, put it back into its normal position, it actually had a lowering of the blood pressure overall. No adverse effects were recorded. Restoration of Atlas is associated with marked and sustained reduction in blood pressure, similar to the use of, I actually put it on here, 2-drug combination therapy, right? So what they found out was that just adjusting that Atlas actually lowered blood pressure more than 2 different blood pressure medications and had no adverse effects. What other things can we do, right? The foods that we eat actually can affect our blood pressure if we're trying to lower our blood pressure. What we're trying to do is you want to eat, I'm going to actually, if you, next month I'm going to be putting out another video, and it's going to be going over how to eat a whole thing about how to eat, but I'm going to associate it with diabetes. I'm going to talk about that. Now, half your body weight in ounces of water, so making sure that we get plenty of water is incredibly important, right? For the reasons I talked about earlier. Simple diets like the Mediterranean diet, where you're getting lots of healthy anti-inflammatory fats mixed with some inflammatory fats. Things like the ketogenic diet can actually be performed for short periods of time, up to 2 to 3 months. And then kind of you want to do cycling between ketogenic, which is where you're increasing the amount of fats and really limiting the amount of carbohydrates that you take in, so less sugar. Can actually be very beneficial. Again, you want to cycle through that because you don't want to just stick to a ketogenic diet completely, because your body does require carbohydrates, okay? It needs it. An anti-inflammatory diet can do the same thing. High potassium foods. Apple cider vinegar, which actually has high potassium levels, right? We talked about having higher potassium can actually lower blood pressure, and it's also alkalinizing for the blood. Also helps the microbiome, right? White tea 2 times per day can actually do this too. As well as dark chocolate. Dark chocolate can actually have a lowering of the blood pressure. And juicing to cleanse the blood, right? So if we're toxic, we can actually start taking more juices and actually can lower the blood pressure as well. Simple supplements, right? Like magnesium. Magnesium is really a powerful one. It relaxes the blood vessels and the muscles, right? And we talked about the muscles that surround the arteries. So we want to make sure that those are relaxing, and you need magnesium to be able to relax those arteries, okay? So taking magnesium, particularly, so what I put here, 500 milligrams before bed. You always want to consult with your doctor or anybody that's you're seeing, or your physician, to make sure that any of the supplements that I'm talking about are good for your body, right? Fish oils, 1,000 milligrams daily. CoQ10, and if you don't want to do fish oil, there's other supplements out there that are vegan in nature. So things like Pure Form oil, that's a Canadian brand. It's actually very good, very well made. CoQ10 has a really good beneficial effect on the heart. 300 milligrams daily. Things that are also, like I talked about, vasodilators like cocoa. Garlic in your diet or in a pill form can actually be very lowering of the blood pressure. It's anti-inflammatory in nature as well, and really helpful for the immune system, and it's super tasty. Essential oils. These are some essential oils that have been shown to decrease blood pressure. Neroli, I'm just going to list them off. Neroli, lavender. Lavender just smells good, has that, and you would probably think about that, right? When you smell lavender, your body just naturally gets into a state of more relaxed state. The smells that you have has a direct correlation, obviously, to your brain and your physiology. Okay. Sweet marjoram, clary sage, frankincense. You could use these in a diffuser. In other words, you get a diffuser, put the oils in there, let them drop in, let them mist out into your environment. Or you could just put them directly onto your skin with a carrier oil. Something like coconut oil or fractionated coconut oil can do that. Okay. Meditation, right? So meditation is very good. We talked about some of those breathing techniques earlier. That's a form of meditation in itself, right? Training the mind in order to receive a benefit or as an end itself. It's been shown, you sit there, quiet the mind, relax, focus on your breath. You could also focus on a word or a sound. There's really a lot of different apps on this, especially, particularly if you're a beginner. I like different apps for this. So things like Calm, Insight Timer. There's a number of them that you can get, which will kind of just walk you through and guide you through process. You could even just go on YouTube and just look up guided meditations for stress relief. There's plenty of them out there. There's no shortage of good things to kind of teach you how to do these meditations. I'm just trying to give you some, I am giving you some information to just kind of get you started, okay? And by doing this, what are we doing again, right? We're getting our body into a more relaxed state, switching on the parasympathetic nervous system, which has a natural relaxation of the blood pressure. Here is one of the things that we do in our office, just kind of get a gauge of the health of the person and kind of see what exactly their body needs at any given moment, right? So what we do is we do full blood work, urinalysis, hair sampling, things like that, as well as a full chiropractic workup to make sure we're looking at the whole nervous system itself. So we're checking out the nervous system, making sure, see how we're doing with that. Then we're looking at the actual blood chemistry, and this is it for the people that we feel like we need to do it with. We're looking at the full blood chemistry. You're looking at any types of, so you get hair samples, blood samples, urine samples, toxic challenges if we need it, to see exactly what's going on, what kind of deficiencies that person might be dealing with in terms of nutrients, and what they're sufficient with as well, and any kind of toxins that they might be dealing with in their internal environment, with their environment. This is a sample of somebody's hair, right? We take a hair sample from them, find out and see exactly what kinds of let's say heavy metals that are inside their body, which is a toxin. If you want to know more about toxins, check out my toxin video. Really, really good. Got as much information as you need to know about what toxins are out there. So this measures different levels of let's call it if they're good, if they're critical, high risk, or they're just warning levels, right? So if it's green, normal, that's optimal level. If it's in the yellow, that means that it's a warning. You know, it's not technically in a bad range in terms of your traditional testing, but for our testing, we want what's optimal, right? And if it falls outside of the optimal level, you're in the warning level, right? When you get into high risk, that's red, and then critical would be blue, right? Code blue. Now we're testing this thing, as you could actually check to see, and what ends up happening is you look, before and after, right? So you get a prior rate and then you get a current one. What you should see is these red ones and these blue ones should start going lower, right? This person had high lead and high mercury in the critical range. We did, and this was just an example case. We went through this, got them. Either taking the right supplements or right detox protocols, they start dropping into the normal levels. I like this because you can test to see whether what we're doing is working or it's not. And it can go from there. You can look at obviously measure for this one, measure your blood pressure. But you're not just measuring blood pressure, you want to measure the whole system to get a range of what's going on in the body. An example of this, let's say somebody had a nutrition deficiency. That person, if they had a nutrition deficiency, we would supplement them with the proper nutrition. So in this case, vitamin D was the nutrition that was missing. Supplement them with the vitamin D, and over time, you could start seeing those levels rise, right? This would be an example of a supplement list that we can give to that person and what they should be taking, right? And if anybody has any questions out there, please just drop them in the comments below. If anybody wants a free consultation, we always offer free consultation at the office. Please give us a call and we can get you in and take a look and see what's going on with you. Okay, thank you.